I'm a phlebotomist at a prestige world well-known hospital. I am the person that draws your blood, the person you roll your eyes at, or curse out because you're either afraid of needles or just tired of being stuck. I am also the person you sometimes call a vampire. So, if you still don't know what a phlebotomist is, or what they do in general terms, I am the person that draws and collects your blood in tubes for lab testing when you have to stay in the hospital. However, I don't only focus on collecting your blood samples. Being in the front line of the trenches, I get to see you in the first stages and many stages after. Your smiles, your laughter, your tears of pain and suffering. When you're more in pain, the more often you'll ask for pain medication. When I see a patient in terrible states, I sometimes in my head ask, why is it okay to casually prescribe opioids or something similar to opioids, but not CBD? Today I will be discussing the medicinal benefits of prescribing CBD to patients staying in the hospital. I will explain what symptoms patients experience, what is CBD, and what positive effects it has, and what negative effects or downsides CBD has. Y-Work is the first and only hospital I worked in. Not only do we treat cancer patients, but since we are a state-run hospital, we treat all kinds of patients with all kinds of illnesses. However, our main focus are our cancer patients who are being treated with chemo or radiation therapy, receiving stem cell transplant, who just received a surgical procedure, or just want to live their days out comfortably. They experience nausea, restlessness, immense pain from a tumor or tumors, have no sense of foreign appetite, depression, and anxiety. CBD stands for cannabidiol, which is an essential component of medical marijuana, but does not contain the psychoactive drug that makes people high. It is known for the treating of the cruelest childhood epilepsy syndromes that causes seizures. CBD is commonly used to treat anxiety, insomnia, and chronic pain. They can be made into different forms such as edibles like gummies and honey, or drops to put under your tongue like this, or in your mouth. Currently, the hospital I work at is prescribing a form of CBD known as Marinol, but it's not enough for these patients and is synthetically made, not in its purest form. When patients complain about their pain, all they are being given in the meantime is a low dose of Tylenol until it's time for their hard stuff, which is, the harder, heavier medication. Medications such as fentanyl can cause hallucinations, restlessness, anxiety, and kidney damage, to name a few, and possible respiratory issues that can lead to pneumonia. So the downside to CBD is that there's not a lot of research. And the question is, why isn't there a lot of research? And the possibility is that there are still conservative views to the fact that it is from the marijuana plant. And marijuana has been given a bad name since the early 1920s, let's say, where it came from Mexico, and when it was brought over, the white people were threatened by Mexicans, and then they started spreading rumors that when they were on the drug, that they would sexually harass the white women. And then in the 1920s, it just became worse, and then it just related to racism. So, the conclusion is that we should experiment more, do some more research to help all kinds of patients. I mean, it is legal here in Texas, and just continue to do more research.